Hi, welcome to our Kaplan seminar on critical thinking. We're so glad you are taking the time to find out a little bit more how you might get a little better at critical thinking. This seminar is, it should be about an hour, but it might be a little bit less. And what we're going to be talking about is critical thinking and how you can build your critical thinking. So I put a little note right down here, and in that note it says it's for people who are thinking about being a nurse. It's for students in nursing programs, which I think I'm going to kind of go more towards that tonight. But it's also for people getting ready to take the NCLEX. So I think we'll have a little something for everyone. At Kaplan, we have a lot of seminars like this, and so I put a link down below so you can find some more free seminars and those sorts of things. Down below there's a link. You could copy that if you like. And we have a lot of different free seminars. This one, again, is about critical thinking, but we have other seminars about a practice test for NCLEX. We have that for RN and PN. We also have a strategy seminar that helps people to get their strategies for the NCLEX. And we have a sample class. So you might look for those things if you're interested in different classes. So everyone's a little bit different. Tonight I have Karen with me in here to help out. So you'll hear me at times talking to her or referring to Karen, and she's down in the back, and she's the one now who's putting the notes in the box. On the slides, you can see our phone number and our website, so you can go look at those anytime you want. This seminar is both for RN and PN students. So I'll try to bring up things that maybe would be for PN students versus the RN. So I'll let you know about that as we go through. All right, so let's see what's up tonight. This is a game called Sudoku. Now, this is not a game that I like. This is not one of my favorite games, but this is a game of critical thinking. Karen loves this game, and it's something that she likes to do often, and she finds it relaxing. For me, this is not a relaxing game. So if you don't like this game, it doesn't mean you're not a good critical thinker. But I want to explain to you why this is critical thinking. Because to be able to do this game, you have to understand the rules, right? You do have to know numbers. You have to know the numbers 1 to 9. And you have to put those numbers in each box, numbers 1 to 9, and across 1 to 9. Now, the frustrating part to me, and probably the fun part to Karen, is that in each box, only one number fits here. It's not more than one. Sometimes I'll put the wrong number in one box, and the whole thing is just wrong. But you have to find the precise best decision based on the rules of this game. So you have to make sure that in each box, each and every box, you put the right answer. It's coming up with the best answer. Critical thinking is like that. Critical thinking is where you're thinking about your thinking so that you make the best decisions. It's what you did in clinical. Remember in nursing school, or if you're still in nursing school, you went to clinical. And the night before, you prepared for the day to different degrees. You do different in your first semester than compared to your last semester, but you prepared for clinical. Oftentimes we're preparing and there's a lot of anxiety, right? Because you don't know what the day is going to bring. And that's the way that nursing is, because you don't really know what's going to happen. Even if we plan out our day, we don't really know what's going to happen. But we're always, in every instance, trying to make the best decision possible. Just like in this game, right? We're trying to make the best decision with the information that we have. And that's why it's very tiring being a nurse, right? So in clinical, you were taking the information that you had and trying to make the best decision possible. In clinical, your instructor is making sure of 2 or 3 things. 1, that you're awake and ready to go. 2, that you're able to critically think. And 3, that you're safe. 3rd is probably most important. If somebody in clinical stayed up all night, preparing, doing their paperwork, and they're very tired, right? You can tell that's probably not a safe person, probably not good for them to be in clinical today, right? So critical thinking is like being in clinical. It's also like the NCLEX, where you're trying to come up with the very best answer possible. The very best answer possible. Will it be the perfect answer? No, but you're looking for the best one possible. Now I want you to think about what this game is. You might not know. When I have this class, we have this class sometimes with students, and I have them guess, what is this game? And very few people remember or have ever seen this game. It's kind of an older game. Most of you probably play this on your phones now. It's called Trivial Pursuit. And with Trivial Pursuit, it just was a bunch of cards, and if you landed on the green square, I would have to ask you a question that's on the card. So if you landed on the green square, I'd have to ask you, how long is a goldfish's memory span? Now, that's something you probably don't know. Now, we would think, if we're critically thinking, we could think he probably has a memory span, right? Because otherwise he'd probably just keep hitting the glass over and over, right? He can remember that there's glass there, maybe. So he must have a memory, but how long is it? You'd probably just have to guess, right? This is content. This is content. This is something you either know or you don't know. It's a recall question. This is similar to when you're doing your prereqs for nursing school. When you're doing your prereqs for nursing school, you're learning a lot of content. Anatomy and physiology. You learned that this bone right here is called the mandible. And you memorized that. And you drew it in your coloring book. And you had to memorize how to spell it. And then on the test, and I know it wasn't this easy, they had an arrow pointing to this, and you wrote in mandible, and you got it right. And that's awesome, and it's important to know. But that's just recall. That's really the lowest form of learning, when you just memorize things. For the NCLEX, there's lots of things you have to memorize. You do have to know about the mandible. You have to memorize lab values. You have to memorize about the ABGs, right? You have to memorize developmental stages. There's lots of content to remember. But it's not enough to go into a patient's room and say, "Hi, I'm your nurse," and that's your mandible, right? It's not enough to do that. Nurses need to be able to do more than just remember content. Nursing's more like the game of Clue. In the game of Clue, if you've ever played that, or if you like to watch TV shows that are mystery, trying to figure out who did it, with those, you're trying to solve a mystery. And that's more like what nursing's about, right? With nursing, you have to put together the fact that I have a mandible, and it's broken, and now you have to figure out a way that you're going to get me some nutrition. And then if something goes wrong with the NG tube that you gave me, what are you going to do? That's what nurses do. They solve mysteries. They look through the information that's given to them, and they pick the best answer to do. They know how to prioritize. In the real world of nursing, it's very busy, and you guys have seen that, I'm sure. It's very busy. You have to make decisions on the spot, and you're trying to make the very best ones. You might think, "Oh, my patient's having a little trouble breathing. I'm going to help them." And in the next bed, a person starts to code. That's what the real world of nursing is like, and you have to make the best decision in that situation. On the NCLEX, you cannot multitask. You can only pick one thing, and that's all. So that's sort of like a mystery. You have to figure out what's the best thing to do. And you did do that, or you are doing that in clinical too. So we want to be critical thinkers. So what is a critical thinker? It's someone who's skeptical. Now, I teach pediatrics, but I used to work in the emergency room. And when somebody comes into triage and they say to me, I'm having some abdominal pain and I'm not feeling well, I'd say, oh, there's something wrong with his stomach. No, I don't. I ask some more questions to try to figure out what's going on, because a lot of other things could be going on. If they said, I have a stomach ache, but I've been really stressed lately, do I just say, oh, they must be having indigestion? I don't do that, because I want to figure out, because the worst thing that could be is some sort of cardiac issue, right? I have to kind of keep digging, getting more information. So I'm a little bit skeptical. I don't just believe what one person tells me. I want to get more information. In that situation, I'm using my critical thinking and I'm asking a lot of questions and I'm analyzing their answers. And people that are having chest pain or MI type symptoms, what do? They deny. I'm fine. Just tell me everything's okay because I really just want to go home, right? Got to get some more information. Can't just say, you've been stressed and your stomach hurts, so just go ahead and go home. Got to be careful, right? Got to ask questions and analyze. Got to get some more information here. You can start thinking about what you might want on that patient, and I'll give you some clues there. We're also open to new ideas and perspectives. And this is very interesting because this happens all the time. We wish that somebody would give us a book and say, here's how you be a nurse for the next 50 years, and you're going to be a nurse, and here's everything you need to know. But it's not like that, is it? It changes every single day. There's so much new research about medications that come out, about treatments for patients, about ways to do things that were not something that we've been doing in the past. We're open to that. We're able to critically think through those and decide if that's good for our patient. We're also able to learn independently. Group study is great, but when you're on the floor, you got to be able to think on your own. So it's really important to understand yourself when you're a nurse, because you're going to be faced with challenging things, and you have to be able to learn and do this critical thinking on your own. So supporting each other's critical thinking and the way that people are thinking through problems is really important when you're in the clinical setting or when you're having your clinical conference. Have you ever gone through clinical conference and people are sharing and you think, gosh, why didn't they think of that earlier? Or wow, I didn't think of that. Everybody thinks differently. But we want to help each other to be good critical thinkers so our patients end up doing well. We also are able to see similarities and analogies that are not superficially apparent. And that makes sense when I was talking about the patient who was having the abdominal pain, right? You're thinking, abdominal pain could be MI. I better make sure it's not before I give this guy some antacids or something, right? I want to make sure that the superficial thing is not a real problem. That's really important. Because a lot of times problems with patients are diagnosed by nurses because they're doing a detailed assessment and always trying to get more information. We're able to apply these problem-solving techniques in domains other than those learned directly. So that's kind of like in theory. When you're in your lecture class of theory, or if you're taking your CPR class or any sort of classroom, hardly ever do you take the information that the teacher is giving you and apply it right to a patient. You take some of that information, and when you get into the clinical setting, you're able to say, in CPR we learned this. In this situation, I think I'll try this. You're able to apply information that you learned and those problem-solving techniques into different settings. And that's challenging because what you hear in lecture and class can be a lot different than what happens in clinical. And we're also able to think about, and this is really important for you all that are taking the NCLEX, what would happen if we did that action? This is a really important If you're watching this on a recording, you might pause here and look at that and think about it. Because if you're a person who gets to a question and you get to the very end and you have two answers, you want to do this last statement. What's going to happen if I do this one? What's going to happen if I do that one? By doing those two things, you will be able to decide which one is better. Because of those, you want to think, what's the safest answer? I'm either going to send the person home or I'm going to get some more information. What's safer? Getting more information. Makes sense? You're trying to figure out what would happen if I got more information, right? It would help me know if this is a cardiac problem. And definitely, I'm sure all of you are active and not passive. It is very hard to be passive in nursing school. You are very active learners, always focused on the patient, learning, changing. Nursing school is very difficult, and you become another person in nursing school. So that takes a lot of activity. So here's what you're going to write down. This is the steps to critical thinking, and Karen will write these down for you, but usually my students ask about what are those steps again, so you might want to write them on a little note for yourself. Step one is to organize the data. And when you're looking at a question, that means look at a question and get the information out of the question. What is happening here? What is happening here? Organize that data. Step two is to validate the data if necessary. So in our patient, let's go back to the emergency room, our abdominal pain patient, you're saying, what's happening here? Is he having anxiety or is he having an MI? Step two is validate. If one of my options is check an EKG, that's not a bad idea because I want to see if he's doing okay in his cardiac status. That's what validate is. Kind of helps you clear up your suspicions. Step three is to eliminate, and most students are good at that. They're able to eliminate at least one or two of the option choices and say, this is not the answer, or this is not important information, right? And step four is to evaluate what's left. A big part of step four is to anticipate the probable consequences of what you pick. Right? Anticipate the probable consequences. Thank you, Karen. She's typing those up for you there. All right. I'm going to give you an exercise in critical thinking. Now, I don't know Chinese. There's probably some of you in here that do, though. But these are the words in Chinese for entrance, exit, and gate. Now, you're just going to have to trust me on that. These are the right words. So this is all you know about Chinese, right? This is all I know about it. So what's the question? Which of these translates to mouth? Well, shoot. You could say, you could look at this question, just like you could with any NCLEX question, and say, I don't know. Throw up your hands and say, I don't know a thing about Chinese. Why is she talking about Chinese in this class? This doesn't make any sense to me. But you have three different words here. Now, I don't know much about this, but if I look at these, I can see, I'm going to pull over my drawing tool here. I can see three words, and there's a symbol here that is the same. So I'm using my steps, right? I'm organizing my data. And if I look at these things, I see three of the same shape in each of these words. Now, if I look at these words, entrance, exit, and gate, think about it for a second. What do they have in common? They're all openings. They're all openings. And then you look at the question, which of these translates to mouth? And mouth is an opening. And here's the shape. Does it make sense that this is an opening and these are openings? Yes. If we go further, because we're not done with our steps, we want to try to eliminate. Let's look at that. There is this shape. Is this in any of the other drawings? No. Is this in any of the other drawings? No. If you picked either one of these, you were guessing. And there is no guessing when you're taking care of a patient. There's no guessing when you're taking your NCLEX. All right? So your best answer here is your mouth opening. All right? So that's what critical thinking is. Even though you might not know anything, and even though you might not even care about this, you have to think, what's the best answer here? What's the safest choice? If you can get over your frustration with this, because I know some people do get frustrated with this, you're able to see that this is critical thinking. And you do have to put these things together. Because sometimes you'll get a patient who's having a problem, and you don't know exactly what that is, but you know there's a problem, right? I've had that lots of times. Something's wrong with the patient. I don't know what it is, but I do not want them to go back to the waiting room. This baby that I have is not ready to go home, and I can't even tell what's wrong yet, but something is wrong, and I don't know what it is. That doesn't mean I should guess and just say, well, they're probably fine, right? That's not safe. So be careful there. This is a lot like nursing. All right. Now I want you to look at these. And you can pause here if you're watching the recording. I want you to think about, what's the way you learn the best? What's the way you learn the best? Because these are all ways of learning. And you do almost all of these in nursing school, right? You do almost all of these in nursing school. So think about what you do in nursing school. Sorry, I'm just trying to find that, Karen. Thank you. Good. All right. The number one way is simulation. Simulation, you retain 90%. That's a lot like doing clinical. Simulation is a lot like clinical. I bet if we were in the same room and I said, oh, tell me about your very first day of clinical, you probably could tell me almost everything that happened. Now, I graduated from nursing school a long time ago, and I remember almost every single day of clinical. That is simulating an experience. It's really living an experience, right? And that's the same as acting, because that's like simulating. So simulation and acting, same. The next highest is discussion, and that's 70%. So that's what group study's for. Sometimes group study can be frustrating, but if you can get in a discussion about the topics and stay focused, you can retain 70%. The key is finding a group that works for you. So don't get rid of group study because the first one didn't work. Just try to find one that works for you. The one that people like is watching a demonstration. And there's someone cooking. Now, if you've watched a cooking show, you can believe me on this, that the retention of that is only 50%. Because I will watch those, just stare at the television and watch, and I can't tell you at all how to make the thing that they made, right? I say, oh, they did some butter, and then they made some rice, right? I can't remember any of the in-between. So you remember about half. That makes sense. The next one is pictures. Looking at pictures, right? So watching a movie, watching a demonstration, same thing. Looking at pictures is 30%. Listening is 20%, so that's in lecture, right? Lecture's tough. Lecture is tough because you retain about 20%. And then reading is the lowest at 10%. So you guys that have trouble and not remembering when you read, you're just being honest because reading is hard. Reading is hard to retain. Now, I asked you what's the best way to learn, and if you were thinking, I like all of these, then that's awesome. Because if you read before lecture, and then you go into class and you listen, and you participate in a discussion with the instructor, you're kind of engaged with the classroom, you're getting up there, right? You can be in that 90% range when you're doing all that. Bring your book into class. Look at the pictures as the instructor's going through the information. If there's some sort of demonstration during break, to try to find groups of people and say, hey, that was pretty weird what she was saying in there about asthma, right? I didn't know that. That's you participating in a discussion, trying to retain the information. So think about the best ways that you learn. These numbers of retention that I gave you are an average. So everyone's so different. So make sure that you're using all of the methods, or definitely the ones that work best for you. Let me go back one more time. When I was talking about NCLEX, you guys that are getting ready for the NCLEX, simulating is 90%. So that means that before you take the NCLEX, you need to simulate that experience. So taking questions on a computer is very helpful, because then you feel like, okay, I know how to use it. I know how to use the calculator that's in the computer. I know what's happening with the mouse. I know when I see a box, I know how to move forward. Simulating that experience is very, very beneficial, very beneficial. So hopefully in this discussion tonight, you are watching me. That's more like watching a demonstration, right? Hopefully you're thinking and maybe mentally participating in a discussion, maybe questioning some of the things I'm saying. That's awesome, because that's getting you to think about it. You're listening, and hopefully you're writing notes, right? So you want to be writing some notes too, and that keeps you more engaged, and that's very helpful. Okay, so here's someone that looks like she's taken the pulse, right? You remember the first time you took someone's pulse? I do. It was very stressful to me. I was so nervous. I could hear my own pulse louder than I could feel the person's pulse, right? Very, very stressful situation. But in nursing school, you're trying to get these skills, right, so that you're simulating doing it in the real world, right? And in nursing school, the content's the foundation, but the experience that you have in the lab helps you to learn actively. So we want you to learn the content. That's important, but we also want you to be a good critical thinker. So you're making good decisions in clinical and when you're taking tests, all right? And when you're taking tests. Let's see what I got here. So this is what nurses do. We're identifying a fact versus an assumption. Let's go back to our patient in the emergency room. They're saying, oh, my stomach hurts, I don't feel good, but I've been under a lot of stress lately. I'm probably okay, right? Got to be careful, right? Because you don't know if they're okay. You don't have enough information. So be skeptical. Don't make an assumption. And figure out the facts. The other thing is you have to find out what's relevant. Now, maybe I'm saying, oh, I don't feel good, and I've been kind of stressed out, and I ate tacos for lunch, so probably that's why I don't feel well. Is it important that I ate tacos? You don't know. Gotta make sure it's not something else, all right? Gotta make sure. Let's skip this one. We also need to know how to set priorities. This is something nurses do every single day, over and over again. And it starts when I give you a report from night shift. You're coming on day shift and I'm on nights, and I tell you about 4 patients. And the first thing you have to decide when you look at the patients is, oh, which one do I see first, right? You also have to figure out if I didn't tell you something. Now, maybe I'm on night shifts and I'm really tired and I kind of got to go because, you know, I got to take my kids to school. So let me just tell you real quick, give you a report. Okay, I got to go now, right? Well, then you get the report and you're like, wow, Bridget didn't do a very good job of telling me a report. I better go in there and listen to that baby's lung sounds because I don't think she told me what they sounded like, right? You're figuring out what the missing information is. So important, so important. And it's what you do all day. You have to give medicines at 10 o'clock. You're deciding who you're going to give the medicines to first. Making the wrong decision can have bad outcomes for the patient. Now that being said, do we always 100% of the time make the right decision? We don't. We wish we did, but we don't. We make the best one that we can with the information that we have. So what I know so far is how I make my decisions. Do I know that maybe the patient that I'm talking about with that GI pain, maybe it just is stress, anxiety, and tacos, right? But we don't know. So we got to be careful by making sure that we have all the information. All right, let's try a question together. And I'm going to show you some strategies tonight that will help you when you're preparing for the NCLEX, all right? Let's read this one together. Now, I want to tell you that this is a passing level NCLEX question. Now, those of you that have already read the question and already answered it, I'm worried about you because you're going too fast and you're not getting the information that you came here for. You came here to figure out your critical thinking and how to best answer NCLEX questions, right? That's what everybody wants. Everybody wants strategies to do better on the NCLEX. So let's read this together, and we can eliminate. Remember our steps. Let's go back to what Karen wrote if you need to go through that. Organize the data. Let's look at this one. 23-year-old woman is admitted to the emergency department with a ruptured ectopic pregnancy. A laparotomy is scheduled. Pre-op, which of the following goals is most important to include in the client's plan of care? Now, you can pause now and think of what is the topic of this question. You can pause it, but I'm going to keep going if you didn't pause. Well, it has her age, and it has where she is. We know it's important that she's a woman, I guess, but her age isn't really that important, and it doesn't matter where she is. But what does matter is that she has this problem. Now, some of you are thinking, I haven't had that in school, or you're thinking, I don't remember what that is. That's okay. Because when you get on NCLEX, you're going to see things that you don't know what they are. When you're preparing, you can write it down on your paper and review that content. That's awesome, and you should do that. But when you're taking the real test, you don't have that luxury, right? So you would look at this word and say there's two words I do know. One is ruptured, and the other is pregnancy. I might not know what an ectopic is, so I do need to look that up later. But a ruptured pregnancy sounds bad. I don't want that, right? Doesn't say how far along she is. It just says she's having a ruptured ectopic pregnancy, okay? So a ruptured pregnancy. And then it says here, a laparotomy is scheduled. Now, whatever this is, if you don't know what that is, look it up later. It hasn't been done yet, so it doesn't matter. Right now, she's still having a ruptured pregnancy. So now we're looking, pre-op, which of the following goals is most important to include in the client's plan of care? So this question topic is priority ruptured pregnancy. All right. I'll show you a couple strategies here that we teach in NCLEX with Kaplan, so maybe you can use these. Number one says supply emotional support. And I want you to think, is that an assessment or an intervention? Assessments give you information, and interventions do something for the patient. This is an intervention. Number two says maintain relief of pain. That's an intervention also. Provide fluid support. That's an intervention. And number four says obtain respiratory therapy. That's an intervention. All right. So they're all doing something for a ruptured ectopic pregnancy. That is good because something bad is happening to this person and we want to do something. We didn't need any more information, did we? We just needed to know, we wanted to do something. Okay, let me show you another trick. Number one says supply emotional support. Now ask yourself, is that meeting a physical need or a psychosocial need? It's psychosocial, and I'll use the psi symbol for that. It's psychosocial, right? It's making them feel better. Number 2, is that physical or psychosocial? Now, this usually frustrates people because it's not physical. It is psychosocial too. The reason it's psychosocial is giving them pain medicine isn't going to fix their ruptured ectopic pregnancy, is it? It's just going to make them feel better. Psychosocial. Provide fluid replacement. Physical or psychosocial? It is physical. So you see me make a P there for physical. It's physical because it would help them physically. And number 4 is obtain respiratory therapy, and that is physical also. All right, so as we go through this, I can eliminate anything that is psychosocial. People that are having a ruptured ectopic pregnancy, do they need emotional support? Yes, they're having a ruptured pregnancy. But on the NCLEX, just like in the real world, you have to prioritize, and you have to pick one thing to do. What's most important? Not supply emotional support. And they have a lot of pain, but relieving their pain will not stop them from having the ruptured pregnancy. So now if we look at 3 and 4, we see 1 in 4 is an airway answer. So let's look at that one first. Respiratory therapy. Now, I've taught this class a lot, and I've used this question a lot. I have no idea what that means. It might mean go get him some oxygen, or it might mean go get the respiratory therapy lady, or I don't know what it means. Give him an albuterol treatment. I don't know. But the question is this person with a ruptured pregnancy having airway problems? No. They are having circulation problems. Ruptured pregnancy, worried about hemorrhage, blood loss, best answer 3. Best answer from what's available, right? It's what's available. The perfect answer won't be there always, okay? All right. So this is what we do. We try to understand the topic. We organize the data. We validate anything that we're suspicious of. We're identifying missing information, and we use facts and don't make assumptions. Now, when it says assumptions there, there's another word for that. It could be making up a story. Some of you are really good at making up a little story. Well, what if the patient, one time when I was in clinical, that's you making up a little story and adding more to the question than what's there. Be careful. Don't make up a little story and don't make assumptions, okay? Resist. All right, let's skip that one. Okay. Increase your critical thinking skills. So we have our same. You want to practice those steps until they become mechanical. And again, Karen did, she's so nice, she put it right down there for you. So you want to write those down. You always want to identify the topic and think about the best answer. You want to practice it over and over until it just becomes normal for you. Again, practicing NCLEX questions on a computer will help you be more mechanical too. You want to list down those steps and follow them when you're solving a problem or choosing an answer. That's a really great thing to do when you're getting ready for your NCLEX. Really will help you on tests. You cannot guess. You got to use this process so that you're not guessing or just picking it because it sounds right. Now back on that last question, I could have picked respiratory therapy because that was airway. But it didn't make sense. It sounded right, but it didn't make sense. That would have been just guessing, not okay. Best answer was the circulation. And then we eliminate. And most of the time, you guys are really good at eliminating answer choices. It's getting down to those last 2 that bother you. And you want to work with logic games to give you mental exercise. Now, believe me, I'm not going to work with Sudoku because I do it on the airplane and I lose my patience and throw the magazine across the airplane. But you pick what works for you so that you get a little workout for your mind and keep you sharp and alert, okay? But working with NCLEX questions is another way to do that. All right, what we're going to do now is talk about when you're preparing for the NCLEX and what you should consider when you're thinking about getting ready for the NCLEX. Some of you have time. Some of you are getting ready now for the NCLEX. So you want to think about what is the best thing for you, because you are the most important thing here. Karen and I both we're both instructors at nursing schools, but we work for Kaplan because we want to help students pass the NCLEX. That's why it's so rewarding for us. So we know that a student has to be all in on the program that they choose. So when you're thinking about what way you're going to study, whether you're going to do a program or you're going to study on yourself, I want you to think about these things. Does the course include adequate and realistic practice? We talked about what realistic practice is. It is you on the computer asking questions, all right? Answering the questions on the computer over and over. It's not you laying on the couch with a paper and pencil eating popcorn, right? Because in the NCLEX you can't eat food, you can't bring water, can't have your glass of tea, can't have your phone nearby, right? Got to be on the computer in silence, nice clean desk. You want to think about these critical thinking skills, and we went through a lot of that tonight about prioritizing and how you're going to pick the best answer for the NCLEX. So think about that. Now, this is the one that I think is most important, is you want to pick a program that works for you, that is flexible, lets you study in a way that works for you. Because we meet students a lot that didn't pass, right? Didn't pass the NCLEX the first time, second time, third time. And a lot of times it's because it's not that they didn't have enough questions, it's just that they maybe bought too many books, or their friend who graduated last year gave them a book, and so they did that, and their friend passed, so why didn't they, right? They're all over the place. They have books here, they're doing this, they're doing that. They're not focused on one program. When you sign up with a program, like let's say you sign up with Kaplan, we don't want you to go out and go to the bookstore and buy more NCLEX books. Having the NCLEX books under your pillow when you go to sleep doesn't make you learn it, okay? You want to pick a program and stick with what you have. We don't want you moving around because you won't get everything from the program that you sign up for. So pick a program that you believe in and is in that is something that you're going to complete. Because doing a little bit of this program and a little bit of this and a little bit of that means you're missing something, okay? Be careful there. And then you want to always look at the guarantee of any program that you're using. So here's how our Kaplan program works. We have options about what you can pick. We have an in-person, so that's Karen is in the classroom and you're in the seat and she's up on the stage, whatever it is, she's up on the front of the class going through questions with you, right? Teaching you those critical thinking skills. There's another method is live online, and that's a method where you have an instructor. It's kind of like what you're experiencing tonight, but you also have some TAs down below, and they answer questions for you. All right, so I would be interacting with the students. The TAs like Karen, who's also an instructor, would be answering questions for you. It's very live online. It's not a recording. You have an instructor right there with you to answer questions with you. But you're at home, and I'm doing the talking. You don't come on camera or anything. Self-paced is probably the most flexible and the cheapest way to go. But with self-paced, it's a recording, and you don't get an instructor. So it's cheaper because they don't have to pay us, right? But you have someone you can email if you want to ask them questions, but there are videos of an instructor like Karen going through each and every question, and the same questions you're getting in the other ones, but you're watching a video. If you don't understand something, there's someone to email, and they will email you back. There's not a person to talk to on the spot, okay? If you think, wow, self-paced sounds great, but I also like in person, you can do the self-paced comes with live online and in person, but the self-paced doesn't give you the teacher. Does that make sense? I hope that made sense. I hope that was clear. So you get more than just the class, but I just wanted you to see the difference. Self-paced is really good if you have a weird schedule. Like I've had people that are ambulance, like paramedics, or if you have a weird on-call schedule and you're really self-disciplined, then self-paced is for you. I've had people sign up for self-paced who are not self-disciplined, and then that was just a complete waste. They ended up doing the class too. They just ended up signing up for it because they weren't disciplined enough. You guys know yourself. I'm not disciplined. I would sign up for the class, but then maybe, you know, Karen's pretty disciplined, so she could probably do self-paced. So it's not as fun though. Now, students always ask us, do you have a payment plan? And the answer to that is yes, we do. We have a payment plan. So you just put down $50 and then there's like 3 months and you pay the bills, blah, blah, blah. So if you wonder about this, you're interested, you can get information on our website. So we do have a payment plan, okay? And you guys can look more into that if that's something you really are into. We do have a guarantee, but I do like you to read through that before you sign up, okay? Because that's important, because it's not just you, you have to do some things too. So make sure you read through the guarantee. You have to go to class. You have to watch all those videos that if you do the self-paced. You have to take the test that we give you, and you have to take the NCLEX after graduation. So 6 months after. So there's some things that you have to do to get the guarantee. So just make sure that you read through it before you sign up, okay? That'll just make me feel better because it's better for you to understand it. All right, let's see. All right, this is my last slide, so I will show you what this is all about. This is our code. It's right down here on the bottom, Live 50, and that gives you the $50 off of our program on the comprehensive course. There's other parts that you can just buy. We do give you not just the course. I don't think I mentioned that. We give you the course, over 1,000 passing level questions. We give you an ebook. We have some content videos. There's a whole package that comes with it, and that's all included when you buy our comprehensive course, and you can use this code to get $50 off. There is a way to buy like just some of the questions, but the code of Live 50 does not give you $50 off of that, okay? That's just, this is only for our comprehensive course, so that's what that code is. You can call the 1-800 number, or it works on kaplannursing.com. Students will tell me it has to be capitalized and there's no space between the 50, okay? All right, I'm going to leave you with this slide, and I'm going to say thank you to Karen for all she did back there. She typed her fingers to the bone, and thanks to you all for watching this. So I hope you enjoyed it, and have a good luck on NCLEX. And hopefully Karen and I will see you in a class soon, okay? Bye. Have a good night.